Hi, Dr. Volshteyn here again. I had the conversation with Anthem Blue Cross Blue Shield medical director, and I decided to do a little serious so that people know what we're going through when we're doing peer-to-peer and how challenging it is sometimes to get the surgery approved if you get a person who has no idea what lipedema is. So I'm not going to mention the doctor's name. Let's call him Dr. Michael. So the patient that we have has lipedema, definitely has lipedema. Her lipedema is centralized. What it means is that her lower legs don't look bad, but the thighs are really big and significant. And you can see those dimples in the upper thighs and middle thighs around the knees. But the lower legs on the pictures don't look too bad. But her pain is obviously continuous from the hip all the way down to the ankles, and the ankles swell up. Unfortunately for her, the day when we took the pictures, her swelling was not as bad as it usually is. So I had the conversation with the doctor, and he's a plastic surgeon, which makes me a little bit disappointed. He has been out of practice. I think he retired about 10 or 15 years ago, and now he does medical reviews. So I'm not going to again mention his name for privacy reasons. But basically, he looked at the pictures and said, you know what, because the thighs are big, I'm going to authorize them. But because the lower legs look normal on the pictures, I'm not. And my problem with that is that you cannot treat lipedema as a localized disease in one specific area. Obviously, if all I do is liposuction of the upper portions of the lower legs, the thighs, the insides and outsides, yes, it's going to help this area, but it can do nothing for this. So now we're basically pushing the patient away until she gets worsening of her lower legs to the point that it's going to be worse. And I tried to explain to the doctor this is a continuous disease, and I tried to say it's like almost like you have a breast cancer in one area and say, well, I'm going to allow you to take breast cancer from this area, and I know it can spread to the other areas, but I'm not going to authorize it. Or somebody has occlusion of the blood supply to the lower leg, and you can see a black toe, and you say, well, I'm going to allow you to do here, but the fact there's occlusion of the blood vessels here, I'm not going to because I don't see it. And my frustration with the whole peer-to-peer process is that if I'm speaking to the doctor, you should exercise a clinical judgment and knowledge of what you're talking about. If all you do is open the book and say, well, the lower extremity should be out of proportion to the rest of the body, and you see it on the upper thighs, but you don't see it on the lower thighs, on the lower legs, and you exercise this kind of basic judgment of the book, I don't even understand why we're doing peer-to-peer, because I can just read the same things that the doctor's seeing. So, and kudos to Anthem Blue Cross Blue Shield and Dr. Michael, who reviewed the case. It'll require appeal. As it is, just to get to peer-to-peer, it took us 6 months. But I just wanted to share it with you to show you what we're going through and what kind of walls we'll have to break through in order to get the surgeries approved.